Hey everybody, day 9 and day 10. Sorry I did not post yesterday. I'm just tired. so, still in the PACU area ICU, still with the critical patients. Had another one extubate. Yay. So, we are seeing some positive outcomes. So, that's good in my area. I don't think they're seeing quite the outcomes out on the floors or maybe even in the other ICUs. I know the floors, like the med surg floors, the telemetry floors, I know their nurses are stretched pretty thin and they're starting to get ICU type patients on the floors, patients on the ventilator, but they have more than we have. They're also not allowed to hang the drips that we use on those particular patients. A lot of our patients that we have are paralyzed and sedated. They're not allowed to hang those drips on the floor, even though the patient is in the same situation that ours are in. They have to use IV pushes, and it's just not enough to get these patients comfortable. It's not enough to get them sedated enough to let the ventilator do the work that it needs to do. So their outcomes are not doing so well. Lots of deaths out on the floor. It's very unfortunate. But we just don't have the room or in all the ICUs. The ICUs stay full. So a recap on some of the things that we're doing that nurses aren't typically doing. We are mixing our own drips. These are our critical drips that are usually sent up from pharmacy. We are mixing those ourselves. We do get it double checked because that could be a catastrophic drug error. We are mixing our, drugs to bring up blood pressure, drugs to paralyze patients, drugs to sedate patients, all of our antibiotics. We are mixing all of these ourselves. We are short on supplies. It varies day to day what we're short on. Of course, we do not have pillows. We typically do not have blankets. We have lots of hypothermia, low temperatures. We have one bear hugger that we have to share. So it's like my patient's temperature is 95 and we get it up to 97 and we have to put it on another patient and we just kind of rotate it. We have no pads to go under patients at all. These are the pads we use if a patient has a bowel movement to keep it from getting all over the bed. We're out of those. We were out of IV tubing the day before yesterday, but we did get some in yesterday. So IV tubing is not being changed every 72 hours like it typically does. We're just using it until we can't use it anymore. We were out of oral care kits for a day. We did get some of those in last night. The floors are running out of monitors to monitor some of these critically ill patients that they have out on the floor. Some of the rooms are not being cleaned before another patient gets thrown in there. Just some unsafe practices going on, but I guess we do what we have to do in this time. It's still very real here. Our ER is still very overcrowded. We still don't have an empty bed in the house. Still having lots of deaths. Still utilizing a refrigerator truck for that. So it is very real. I am starting to feel the effects of working this many days in a row, and I'm not even halfway there yet. But I have a good team around me, which helps tremendously. The people you work with, and the PPE is I guess you get used to it. You get used to being that hot all the time. Um, but I know I'm not drinking enough water. I can tell that. And it's just, it's just hot and uncomfortable, but I think I am getting used to it. It's not bothering me quite as much. I find myself taking less breaks from the mask. May have something to do with your mask stretching out. I have noticed that when you put on a new mask, you really notice how much the old mask was stretched out. As for now, we are still keeping our N95s for 5 days. I'm not sure if the hospital will be able to keep up with a new mask every day as New York has ordered. We'll see there. But we do have PPE. I have not went a day where I didn't have what I needed. So that's a blessing. And I will just keep everybody posted, but know that it is still real. Our numbers are still going up. We're not through this yet. I am seeing more traffic in New York, more people getting out, so I hope that doesn't create another surge. So I'll keep you updated. I'll try to post every day. In the meantime, just stay healthy as well as you can and stay home.